Good morning, friends and neighbors. Steve Sanborn here. It is Wednesday, October 9th, and I'm on my way into the PainLab clinic this morning. And I thought I would take a couple of minutes to share some of our progress based on the things that we are doing at PainLab in Lenexa, Kansas. So my idea has been kind of a long-standing one for several years based on the work that I've been doing with certain medical devices. Pardon me, I'm getting over a little bit of a flu-ish thing, so I may have a cough or two. Anyway, PainLab is based on the idea of what I call track and treat. Pretty simple concept, but it came out of working with various medical devices over the last 7 years or so. I can't believe it's been that long, but it has. And so what that basically means is that there's some great technology out there that measures problems, right? Measures brain issues, measures bodily issues, vascular, circulatory, neurological, etc., to the degree that it measures things like neuropathy. All right, so in that case, I'm talking about a device called TM Flow. We call it the CardioNeuro system. We also use WAVI EEG, which measures brain state, brain health, etc. So when we have those objective reports, it tells our medical director, well, what should we do next for the person? So we've tracked the problem, or we are tracking the problem. Now what do we do? So our kind of best and highest use right now is in non-invasive stimulation therapies with regard to electro muscle stimulation and light therapy, both of which are highly effective and have lots and lots of research behind them. By the way, we've just started our blog, so we're posting information about specific cases or specific health challenges that we track and treat. Now, what we're doing on that front is pulling from published research. So, for instance, if I use photobiomodulation, which is light therapy, if I use that for wound care, right, trying to heal a wound, there's tons of published research out there on that subject. So what we do is we take 2 or 3 published research studies and we condense it into a readable summary, and we post it on our blog so that people can learn, quickly and easily what we do, how we do it, why we do it, etc. All right, so all that being said, we've had some really amazing results, not just in our clinic, but people who are using these devices and this approach in other parts of the country are having similar results. Case in point would be our use of Neuro20, which I have talked about before. Neuro20 is a full body or whole body electromuscle stimulation product. It's a medical device. It's FDA cleared and all that good stuff. And it's having some profound effects. Hold on a second here. I'm trying not to cause added problems. There we go. So Neuro20 basically delivers varying levels of electromuscle stimulation, right, at different hertz levels. So some of those signals will help muscle fiber to literally grow, bone density to enhance, endurance and strength to increase. And then some of them are providing more of what I would refer to and what they refer to as like just a massage mode, right? So we can work people out to some level based on their ability, based on the physical or health challenges that they're having. And then, kind of finish up that session with a nice 15 or 20 minute massage mode to relax them and kind of send them on for the rest of their day. Now, we are working with patients who have had everything from a brain tumor extracted from the right hemisphere of their brain, in this case, a surgery that took place years ago and left the patient with left side paralysis, to another patient who had some spinal compression or bulging disc type issues that was causing drop foot. Now, if you don't know what drop foot is, it's basically when you pick your foot up to walk, your foot can't be lifted up. You don't have the capacity to lift your own foot up, and it just drops down. Like there's no muscle control there. Lots of people have drop foot. There are a few different causes for it. In these two cases, we definitely did the upfront measurables, where we did a TM flow and measured their overall vascular circulatory health and their brain state health. And without surprise, when it comes to the patient who had brain surgery years ago, clearly we can see that there's some things going on in that right hemisphere where the brain tumor was extracted. So in other words, there was trauma to that part of the brain. That's generally to be accepted. It happens with the surgery. And unfortunately, it left this patient in a state where walking is more difficult. There's a limp. There's a seized up arm where the hand is kind of caught up into a fist. And it's been like that for 20 years. But having put this patient into the suit, we've now been working with that person for about 3 months. But by session number 2, okay, and we do 2 sessions a week, by session number 2, this person was able to open their hand and close their hand on their own power for the first time in 20 years. Now, that's not an act of, brilliance on our part. It is the effect of the Neuro20 EMS suit. This is what it does. It re-engages the brain and body. It does so many things that it would take hours, I think, to cover it all. But imagine being that particular person who for 20 years had been looking for ways to regain control of their arm and hand. Now, I'm not saying it's perfect. It's not as though it's equal to the right hand. But this is a person who, for the first time in 20 years, was able to pick up a jar with the left hand and walk across the kitchen and set the jar down. All right, so that's a big deal in that person's case. That patient had been looking for these types of solutions for a long time. Now, we've discovered some other things with that patient because we can kind of track what they're able to feel, how intensely they can feel it with regard to the Electro stimulation. But then another person, like I mentioned with the drop foot. Now that drop foot is 100% gone. It was gone within 5 sessions. And the person still does continue to come back and use the suit for, continued improvement around some, at this point, relatively minor neurological signals that they're getting in the legs, etc., but they're subsiding. Otherwise, a very healthy person, but, in the aging state, we're all heading in the same direction age-wise, right? But some people are just a little further down the road. And they end up having these neurological conditions that may come from a more sedentary lifestyle, just the degenerative nature of aging, what have you. But the suit really, really wakes the body back up. And we've made some interesting discoveries about how to best use the suit. And we stay in direct contact with Neuro20 and their doctors all the time, always conversing with them about certain cases that we have, make sure that we can create a protocol that's more custom around what the patient needs. But that's just 2 examples. We're also, working with stroke patients and just individuals who are looking to improve pain points, muscle weakness, and other neurological conditions. Now, I use the first couple of cases because they're a little more profound. And there's definitely practitioners experiencing even more profound results in other parts of the country. And I think I've mentioned in a previous video or 2 that we're seeing people walking for the first time because of the use of Neuro20. But to come back to the track and treat real quick, and then I'll wrap it up. For instance, the TM flow measurement on the whole body circulation, vascular, neuropathy, pseudomotor, endothelial. We're looking at the quality and functionality of even the internal insides of your arteries. And it's a quick and easy test that tells us whether this patient or that patient has neuropathy, peripheral neuropathy, somebody who can't feel their feet, right, or has numbness in different parts of the body, or pain, or both, because that microcirculatory system is shutting down or has shut down. So they're not getting the oxygen and blood flow they need to the tips of their fingers, the ends of their toes, all that kind of stuff. Well, it just so happens that our stimulation therapies reverse and end neuropathy. So if I can capture a person in a state of neuropathy, and sometimes people don't even know they have neuropathy, they're not even aware of it yet, we can turn that around, and we have been doing that. I have a type 2 diabetic who could not feel his feet and had discoloration in the legs as a result of his diabetic condition. That is not the case anymore. We're doing treatments on a weekly basis. He feels his feet again, and we're using, by the way, both. I'm hitting that with both light therapy, which helps that microcirculatory system to vasodilate and cause increased blood flow to those parts of the body, and the body reacts. And in addition, doing the electromuscle stimulation. Both of those therapies can bring neuropathy to an end. Really important here. So as we're aging, certain types of conditions can sneak up on us. One of those is neuropathy. So people who may have insulin resistance or might be heading into a sort of a pre-diabetic scenario, just general aging. There are other causes, of course. Some of them are neurological. If you're creeping up into that neuropathy state, or believe you might be, come on out and let us do a TM flow CardioNeuro scan of your body. It literally takes 15 minutes, and depending on the report that we see, it might be a good idea to jump into some light and electromuscle stimulation therapy to get a handle on that and to kind of, prevent that from continuing and get it reversed and get healthy tissue again, etc. All very possible at PainLab. So again, I'll share a number. It's 833-PainLab. Don't ask me to remember those numbers at the moment, but if you want to call 833-PainLab or just reach out to us, Steve at PainLabKC.com. PainLabKC.com is our website. We are starting to kind of pick up some activity on the social media side. We have a couple of videos now that we put out on our PainLab KC YouTube channel, that kind of thing. And we will continue to produce those as often as we can, but I would encourage you to potentially go out at least and look at our blog and maybe sign up or subscribe rather, so that when we post new posts, when we put out new information, you can get that sent to your email inbox. So post any questions, reach out anytime, and have a great rest of the day. See ya.